Watch the full video, you will never get NCLEX question wrong related to chest tube. Let's have a look on basic lung anatomy. The lungs are surrounded by two layers, visceral pleura and parietal pleura. Between these layers, the space is called pleural space. Normally, the pleural space has negative pressure. It helps to expand during inhalation and recoil during exhalation. It keeps the lung open and supports normal breathing. In case of any injury, trauma, or surgery, air or blood enters the pleural space. So the negative pressure is lost and positive pressure develops inside the pleural space, which causes lung collapse. Due to positive pressure inside the pleural space, chest tube is needed. A chest tube removes air, blood, or fluid from the pleural space, which restores negative pressure and allows lungs to re-expand. Let's learn about chest tube deeply. Chest tube is used to drain fluid, blood, or air from pleural space to maintain negative pressure inside pleural space. Reasons for chest tube: pleural effusion, which means fluid in pleural space. Second, hemothorax, blood in pleural space. Pneumothorax, air in pleural space. Post-op drainage. Damage creates positive pressure inside the pleural space. A chest tube helps restore and maintain negative pressure inside the pleural space. There are two types of chest tubes: pneumothorax chest tube and hemothorax chest tube. There are three chambers of chest tube. The first one is suction control chamber, second water sealed air leak monitor chamber, third is collection chamber. Let's learn about these chambers one by one. Suction control chamber helps to remove air from the lungs. Gentle, continuous bubbling is expected in this suction control chamber. If it is vigorous or intermittent bubbling, then need to report HCP. The second chamber helps to remove fluid from the lungs. Tidaling is expected in this chamber. Intermittent bubbling is okay. Continuous bubbling, then report HCP. If water seal chamber is damaged, the first action would immediately clamp the tube, and the best option is put tube in sterile water. You have to be very careful about the demand of NCLEX question, whether the question is testing you the first action or the best action. The third chamber is called collection chamber. It helps to collect fluid or blood. As a nurse, you have to assess drainage every 1 hour for the first 8 hours, then assess every 8 hourly. Always report if the drainage is more than 100 ml per hour. It should be less than 100 ml per hour. If it is more than 100 ml per hour, it means internal bleeding is going on. Responsibilities after chest tube insertion. At the place of chest tube insertion, it may cause subcutaneous emphysema. Nurse should palpate the skin around the chest tube for crepitus sounds. If crepitus sounds present, nurse will mark diameter of subcutaneous emphysema. If it increases next day, immediately report HCP. If chest tube disconnects from chest, then first action, nurse place gloved hand on chest, never naked hands. The best action is to apply petroleum or Vaseline gauze. Ask patient to perform Valsalva maneuver. Secure the chest area with 3-sided tape. Key points about chest tube. Yes, patient can ambulate with chest tubes. Chest tube chambers should always be below chest level. The location of chest tube placements are apex and base. If it is pneumothorax tubes, it plays on apex, and if it is hemothorax tube, it plays at the base of the lungs. Never clamp the chest tubes during transportation. Equipment to keep at bedside a patient with a chest tube is sterile connectors, Vaseline gauze, normal saline, suture removal kit. Always give opioids 30 minutes before chest tube removal. So this is all about chest tube. I will be posting a video with NCLEX style question quiz in the upcoming videos. Thank you.